I've muted everybody because we just don't want to get that background noise. And I would love for everybody to chat their questions as much as possible. We will really appreciate that. Today we have Secretary James Kenney with us. He is the Secretary of the Environment Department, which is our enforcement agency of our food regulations. And you all are aware of your inspectors, and he's the one that's in charge of those inspectors. We really appreciate everything that Secretary Kenney has done for us during this time of this unprecedented time of COVID. He's been absolutely available to us at every minute. And I've got to say that Allison would text him sometimes at times I didn't think it was appropriate on weekends, and he would get right back to us. And so we definitely appreciate that, and appreciate you coming on and talking to us about this, what are we calling it? Proactive testing. Is that the new word for it? So with no further ado, Secretary Kenney. I'm unmuting you. There we go.
All right, thank you, Carol. Can you hear me?
Yes.
Okay, first I'd like to thank you for setting this up, and thank everybody who's participating today in spending additional time with us. I know many of you have been intimately involved in the creation of and the implementation of the COVID safe practices. So I wanted to thank you for your commitment to continuing to keep the essential workers, meaning those food industry workers, as well as keeping your patrons safe. A lot of what we're doing here is not only building good science, but we're also looking to instill confidence into New Mexicans as the economy opens back up, and as you have the opportunity to continue to serve them. We want them to feel comfortable just as you do as well. And part of that is building good science. And I thought what I'd start with, given some of the questions that we received in advance of this webinar, was just an overview, if you will, on what we're actually doing. I want to try to dispel some myths or misperceptions, but I also want to give you an ample amount of time to ask questions. And I have additional folks from the Environment Department on the call with us from our OSHA program, as well as our food program, and our public information officer. I can see her on my screen, so I know she's on the phone. Maddie Hayden is here as well. But let me just try to set the stage so we have a common vocabulary and a common place that we're starting from. And there's really two things that have been going on. One is the notion of proactive testing, and we use the word surveillance testing, and I see that on the screen right now, that we have the option that we can call it surveillance testing. That rubs a lot of people the wrong way. So I'm just going to call it proactive testing because I think it's easier to say it that way. That's proactive testing of employees to identify if COVID is where it is in the state, where it is in certain business segments, essential business segments like the restaurants, as well as others, and then to better understand how it's spreading throughout the state. That's the focus of what we're doing with surveillance testing or proactive testing. In the event, whether you go through surveillance testing, proactive testing, whatever you want to call it, or you move through, you have an employee who comes to work symptomatic, and you send home, or an employee tells you I'm not feeling good, or they go out and get tested because maybe a relative of theirs in their common household has had COVID and they go out and get tested. For whatever reason, an employee tests positive, that's what we call rapid response. So the proactive testing is helping to build the scientific data that will ultimately lead to less restrictive operations, give us a better sense of where COVID is throughout the state. That's the proactive side of things. The reactive side of things is the rapid response when you know you have, or when you have a positive employee. And I'll talk about how you as a restaurant owner or someone in the business would know that information, because you will be contacted. So on the surveillance side, the questions that we keep getting are, is this mandatory? How will it help? Why would I do this? Do I have to pay my employees when I send them out if I am doing this? Where do I go? Can you come to us? There's a lot of questions. We put together a fact sheet that we send out and have on our website that answers a number of these. I'm not going to read that fact sheet to you because I want to make sure I'm giving you the chance to ask us nuanced questions, because there's never a fact sheet that will answer everybody's questions in total. But the notion of proactive testing, let me walk you through it. So if you decide that you voluntarily want to participate in proactive testing, you can contact any one of the 28 public health offices around the state. We've set aside a time that we thought would be the most convenient, which is Mondays from 8 to 11 a.m. And you can call up any of these public health offices and say, I have employees, 5, 10, 15, 100, that would like to get tested. Can they come in and get tested? And the public health offices will then assist you in getting those folks arranged for testing. That is free to you, whether you're free to you in the sense of the testing. I understand there's a cost to you as well, because you will effectively be paying for them to go get tested under occupational laws. So I don't want to be so cavalier to indicate this is no cost to you, because there's really nothing that isn't a cost to you when it comes to COVID, really. But with respect to the actual testing, that testing is no cost in terms of getting it completed. Whether your employee has insurance or not, there's no cost. And if the employee is positive, then their insurance will obviously kick in. And if the employee is uninsured and positive, then they will be directed through the Department of Health how they can get treatment and what to do next. So this is, again, not something that would cost the employee or the employer for the testing or treatment in the event of a positive employee. So after your employees would get tested, that data is then aggregated. So for all those employees who are negative, that data gets aggregated, and we track that data at the state level, not at the person's name, really not even at your facility name, but we track it in terms of essential employees from the food industry, specifically restaurants, to better understand how your sector is being affected by COVID. And I'll give you some of that data on this call. In the event that somebody is positive as a result of them going out and doing proactive testing, now we're switching into this rapid response. So rapid response, again, is however it's determined you have a positive employee, the following will always happen. You'll be contacted by the Department of Health and by the Environment Department, and we typically are notifying employers within 1 business day. We're looking back at our statistics and observing that. We then go through a series, you'll get a letter from us as well that kind of documents it, and we'll go through a series of criteria in terms of looking to see when that employee was last in your business, who they were in contact with, where the CSP is being followed, because they would minimize spread, we'll work with you. We can get deeper into this, but we'll work with you on a case-by-case basis. And a lot of the questions we get around this topic are, do I have to shut down? How long will I be closed? Do I have to get all my employees tested? And I could say yes or I could say no to those questions, but we will go through all of or those possibilities. We will go through that. And if you have a positive employee, the likelihood is you're going to have multiple employees get tested. You will then have a period in which you will likely have to shut down operations so that you can sanitize or disinfect the facility. That's not always the case. Everyone is a little bit unique in how they operate, and we look at that. Places are typically closing down for a short period of time. They're usually shut down within one day of us talking to them voluntarily, and then they are back up and open probably within 2 to 3 business days, depending upon the extent of what we see from other employees getting tested. So there, we can get more into the rapid response side, but I wanted to give you some idea of what one could expect if you rapid response, you get contacted by us and we say you have a positive employee. So I hope I'm clarifying some of these topics for you. Let me just take a moment to explain why this is so important. And I just need to pull up some data because I think this will really help you understand why we think the food industry is so important for surveillance, so important for proactive testing. Based on all of our data, meaning all of the rapid response we've done to date for all essential businesses throughout the state of New Mexico since pretty much the beginning of May, the food industry, and I'm going to define what that means for you, but the food industry is about 25% of all our rapid responses. That means, or when I break that down, restaurants constitute about 15% of all our rapid responses, food manufacturing about 5% of our rapid responses, and grocery stores are coming in at 4%. So when you think about a grocery store who has prepared food, a place where people go in and pick up meals, not just shop for durable goods, if you will, or canned goods and things like that, perishables, but when they're going in to pick up a ready-to-eat meal, or a restaurant, about 20%, just shy of 20% of our rapid response are dealing with employees who are around prepared foods. I'm not suggesting that prepared foods transmit COVID, by the way. I'm just saying that food workers are in the range of about 20% to 25% of all our rapid responses. When you look at the number of restaurants, restaurants make up 6% of the employers in the state of New Mexico, but are accounting for 15% of all the rapid responses. So those numbers are starting to suggest that we're seeing COVID more in the food industry, in particular restaurants. And then the other thing that I want to point out is that we are also one of the agencies, we're actually probably the agency who gets most of the referrals from the state police. And when those referrals come in from the state police and we go through that data, of about the 1,000 complaints we've received, about 25% of those complaints are specific to restaurant employees not wearing masks. And that means so I think the number's 253 to be exact of those complaints are coming in about restaurants in particular. So when you take a step back from our vantage point and you say to yourself, restaurants certainly are an essential business, and you've known that because you've had the ability in some very limited way to be open this whole time. And we see the number of complaints we're getting about restaurants. We see the response, the rapid response being about in the 20 to 25% range. for those food workers who are handling or around prepared foods, we're seeing a trend here that COVID is predominantly, or in New Mexico, it's very much in the industry by which you all are participating in. And for us, therefore, the best thing we can do is continue to get our essential food workers tested. That will not only help us, as I said, I'm kind of coming full circle here, that will not only help us understand where it is, it will also help us explain to New Mexicans how we are actively monitoring our essential food industry, how the rapid response may not be indicative of all the good work that the restaurants are doing to protect their employees. It also has some positive effects with respect to your requirements or your compliance with OSHA standards, which our department is in charge of. And it also can bring down worker compensation claims and even potentially your compliance and assistance with OSHA and surveillance and the various things I'm talking about would mitigate legal concerns based on our analysis that could arise if you weren't participating in these efforts. So it minimizes risk and gives you more certainty on your end. So let me pause here at a good inflection point and see if there's particular questions. Carol, I'm not watching the chat. I just realized the chat function is there. I'll turn it on.
Yeah, and don't worry about it. We'll have somebody. Oh, I will have. Is that me? Just a second. I will have somebody watch the chat for you and ask questions in a little bit. One of my things that I want to say is that since you and I have talked, and I know what an inconvenience, and you and I talked about the inconvenience of having your employees go to the Department of Health and not knowing how long that's going to take them. And I don't know that you have to pay them or not. This is a requirement by the state, and so we don't necessarily feel like you have to pay them to do that. It is not a requirement of the business, and so in those cases, just like food handler and food safety, those kind of things, if it's a requirement of the state, then you don't have to pay. If it's a requirement of the employer, you do have to pay. But beyond that, as you guys see on your screen, I was contacted by Pathology Consultants of New Mexico, and they will come to your place of business as long as you have more than 15 employees. You can schedule with them to come to your business, and they will not charge you. They will not charge your employees. Most of your employees qualify for Medicare. Most of them, even if they don't have the card, they qualify for free testing. And these folks will just take care of all of that and all the paperwork for you. So, you know, they do not, you know, they're not paying me for this, but I just thought this is one way to make this a whole lot easier on the industry. And they do work in many places around the state, not just Albuquerque or Santa Fe. So a little plug, but something else that'll at least make you think, at least I don't have to send them somewhere and not know how long they're going to be gone.
Carol, I did take a moment to look in the chat box, and I just saw a question come up that I should have answered before with respect to how often does testing need to be done for the same location. And I that's a really good question, and it's a question that I should have again addressed. Regarding the frequency of testing, let me explain it to you this way. When it comes to rapid and I know this won't make a whole, it'll make sense when you take a step back, but I know people are going to be focused on their businesses, as you should. But let me take a step back and explain it this way. Regarding regarding proactive testing or surveillance testing, which Pathology Consultants is offering, and that does sound like a great deal. Not endorsing, but just saying it does sound like a great deal. Regarding the frequency of testing, you can get, if you are a small business with 10 employees, and you want to get all 10 of those tested, all those 10 employees tested every 30 days, great, that's up to you, and you should do what you feel is right. If you want to get 1% of your employees tested every 45 days, great, that's your decision, that's up to you. The point is, we as a state are looking at your industry, as well as many others who are essential to keeping people fed, families protected, the power turned on, your drinking water safe. We're looking at all those essential industries, and we're looking to test about 15% of all our essential industry workers on a periodic basis, 30 days, 45 days. Your contribution of getting 1 or 2 people tested, 1 or 2% of your employees tested, getting 100 people tested is your call. My job is to make sure that we get about 15% of our essential workers tested on a 30 to 45 day period, which is why I'm so appreciative of the partnership that we have, just the working partnership. There's nothing official with the Restaurant Association, the Chili Association, and other groups like this throughout the state. And how soon are the test results provided? Your employees will get the test results within probably 24 hours. If you go to one of our public health offices, those offices will do the nasal swab. If for some reason an employee has a nasal issue, there are opportunities with advance notice to do an oral swab. That's not as common, so you have to make more advance notice of that. Once that sample is taken, it's sent to TriCore or another, it's sent to a lab where that analysis occurs. And then that analysis will indicate if an employee is positive or negative, and those results will go to the state lab. The state lab will work with, the state lab is run by the Department of Health, and the Department of Health and the New Mexico Environment Department get that data within 24 hours. Typically, there could be a reason why it would be longer. And then we hear about it and begin contacting employers at that point. And another question came in is I'm doing exactly, Kara, what you said I didn't have to do or shouldn't do.
Quite all right.
What if we have an employee who doesn't want it to be tested and they don't have a reason to believe they are infected and they've not had any symptoms? Would we need to test them? So the proactive or surveillance testing, it should be that you're testing people on a random basis for a period of time. Like I said, 10%, 20% every 30 days, 45 days, you make the call. If somebody has symptoms, they probably should just go get tested outside of this surveillance or proactive testing. Anybody who's symptomatic needs to contact the Department of Health and arrange for themselves to go get tested. But the goal here of the proactive testing is not to ferret out which employees may be exposed or positive for COVID. It's to build data. This is the part that I said may not make total sense to you as a business owner. It's to build data among the essential worker demographic of restaurants, so we understand, are we getting more COVID negative people or more COVID positive people, and where the disease is spreading. I hope that answers the question.
It's a little difficult. So I have a question. And so this is completely voluntary, is that correct?
It is completely voluntary unless there was a public health order that was issued that said it was mandatory. It is voluntary.
Okay. but it's voluntary on the part of the business and the employee. So if somebody says they don't want to get tested for some reason, they don't have to.
So if, Carol, I've said this before, and when I was before this position, and a while back when I had my own cafe, you set your policies for what your terms of employment are at your business. And if a term of employment is that the employees need to abide by your health and safety instructions, which include getting tested for COVID, that's between you as an employer and your employee. And if they don't want to get tested, then that's something you handle between, as a term of your employment with that employee. I have employees right now who probably don't want to get tested and don't want to do field work. And we have to think about, we're a much larger organization than many restaurants, but we have to think about reassigning them and what do we do in those instances, just like you do. But largely, we will not compel an employer unless you've had a positive employee. We will not compel you to participate in rapid response. I'm sorry, I get them wrong. We will not compel you to participate in proactive testing. All bets are off if you have a positive employee, because we may need to test under public health order authority your workforce at that point.
I'm trying to give people a reason to do this. I mean, what's in it for me is always kind of that, what is in it for the industry? I mean, honestly, so I had the person who works with pathology consultants tell me that he went into a restaurant the other day, and they asked, the restaurant asked if he could test everybody there, and he said, of course we can. They came in with swabs, they did it in about 30 minutes, went out, and everybody tested negative. And he said that the restaurant was, just relieved that that's how it went. It was just, oh my gosh, that's brilliant. Now we can move forward, just not having to worry about it quite so much. So that's one reason to do the testing. Is there a chance that if we do this testing and enough of us do it and we show that there's not much in our industry, that we could be opening up at 100% sooner?
Yeah, I think that is a big plus of how you're describing it. The more data that we collect that shows that COVID is not transmitting in the restaurant industry, the better that outcome will be, because we have scientific data to uphold that the essential workers are protected under the current COVID safe practices, that we're not seeing hot spots that we're missing, or in other words, we're not missing a demographic, and therefore it's flourishing, but we don't necessarily understand it. So that would all lead to us putting it into our various criteria that would move us forward as a state sooner. And the converse is true, and I'm not here to instill fear in anybody, but the converse is true, that if we don't get good data in order to make good scientific decisions, public health-based decisions, then we're going to be prolonged in a holding pattern, and we're going to see more of the same. So I do think that the way you're thinking is the right way to think about this. There are more factors than proactive testing that go into opening up, but this is certainly the type of data that moves us in the right direction. So it's not binary, is maybe what I'm saying. It's not one for one. If we hit 15% of the essential workers and the spread rate is below X%, we're open. It's not that, but this is exactly why so many cabinet secretaries now are enlisted in working on this, to make sure that we're doing as much as we can to minimize spread and increase our ability to open up.
So my thing is, so we keep testing a bunch, we do more tests and we get more positives, and then we get punished for it. It just, there's some piece to that just doesn't work for me. Just, we know that if you do more testing, you're going to find more positives. And then we get punished for the more positives, saying, well, we have more positives, so we're not going to open. And that's just, it's a little frustrating, I should say.
Yeah, I see that, and I think the way we look at public health data, especially the data we're talking about, is not so punitive in the terms of how we think of. I understand that mentality. I know that that's how the public may see it. That's how certain people will see it. That's not how we see it. We put the ratio of people getting tested, whether that's positive or negative, that is helping us understand where the disease is or isn't. And it's not, and if people are following the COVID safe practices, then maybe those are ineffective, and maybe there was something that wasn't followed, or maybe that's part of why we investigate from an OSHA perspective. It may not be occupationally caused. It could be that the employee who tests positive was out of state and picked it up through an airport, or picked it up from a family member. Those are why we do the occupational exposure, occupational investigation through our OSHA program. So it's easy to see how on surface one could draw those conclusions. If there's one thing that I've learned from doing this work, that there's nothing that isn't nuanced, and we go to great lengths, like being here today, to talk about those nuances.
So we have a fairly long question. I'm going to have Dion read it, if you would, Dion.
Sure. This is a comment from Tom down in Cruces. The mandated precautions we have implemented, like health questions and temperature taking each employee shift, is working. Our industry employee average age is clearly in a very, very low risk category. Certainly fatalities related. Frankly, I believe many in our industry are shifting attention, not so much staff getting the virus, which I believe we've been taking many precautions to prevent, to things like staff depression, angst, drug and alcohol abuse, family issues, absenteeism, that are a direct result of COVID. And those are turning into bigger issues for us. Is this being discussed with the health experts?
Yeah, thank you for that question. And I think this is something we're seeing all around, not only the restaurant industry, but our essential industries, and then even broader across the country. But yes, that is being discussed. I think the area in which I've heard it discussed most recently, we see healthcare workers who are really taking a toll on this, or with this, having a lot of the issues you're putting out there, Tom. And those are issues related to mental health that we're discussing here in New Mexico. I know that the governor asks us about this in our cabinet meetings, and has various secretaries working on it from their departments. It is something that, just light bulb going off in my own mind, it may be something when we're seeing 25% of the rapid responses in food related industries. I think the reality that you're sort of pointing to suggests that maybe we are missing the food industry as a candidate for our concentrated effort into those mental health services. And that might be something, Carol, that we could pivot on, or add to our long list of things we should work on together. But I like that idea, and if we can be an advocate in representing this industry to those secretaries and their programs, then I think mission accomplished. I'd be proud to be that liaison.
And if I could add real quickly, Tom, there's also United Healthcare through the National Restaurant Association does have some hotlines and stress resources and things as well. We can get you that link.
So I have a fairly unrelated question, and then I'm going to open this up. And the unrelated question has to do with cooks wearing masks. I had conversations yesterday, and people were telling me that, you know, people are ready to pass out on the cook line. And I have said that shields are okay, and I believe that to be true. Is that right? The face shields?
The face shield without a mask underneath, you're saying face shield instead of a mask. Yeah, we've counseled that face shields in lieu of masks would not be as protective from an occupational standpoint. And I believe Bob Genoway from our OSHA program is on the phone, and we could maybe see if he wanted to elaborate on that. But do you want to keep going, Carol? We can kind of come back to that.
Yeah, that's fine. I do want to get to that because I know everybody on here has cooks that are going through this, and it's pretty painful for them. So I'm going to just do this little commercial here about pathology consultants. And Sarah Rochelle, you're welcome to unmute yourself and just talk about this program for a few minutes, and then we will unmute everybody that has a question.
All right. Hi, everybody. My name's Sarah. I'm the marketing director at Pathology Consultants. And Carol's actually done a pretty good job of giving us a basic outline of what we do. So that's awesome. Yeah, we saw that there was kind of a need for people to go to people's businesses and test and see what we can accomplish, especially for some smaller businesses. And then, of course, for restaurants where you're really in a situation of how long are these people going to be gone and what do we do? So yeah, for anybody that there's over 15 staff members, we can make appointments and schedule days to come out and visit you guys and swab you really quickly. It's a simple nasal swab. It's not the nasopharyngeal that goes way, way back, but it's less invasive and it works really well on our platform. Our platform allows us to test 1,000 kits per day. And we also, on that same swab, have the availability for the oral test. So if you have somebody that prefers a throat swab, we can go ahead and do that with no real extra preparation or anything like that. We just have to be told, hey, we would rather do it orally. So those are some of the basics. Like Carol was saying, we do take all insurances. There's not going to be any cost to you because we're coming to you. Hopefully it's even less cost to you as far as paying your employees. And we can cover all of that for you. And those are really, that's the basics of it. Anybody that has insurance, doesn't have insurance, we can get to where everything is paid for so you guys don't have to worry about it. And we'd love to help you guys out.
So I want to show you all, you didn't have to take down numbers and things. On our website, you can go to the COVID safe practices, scroll down and go to COVID employee testing, and you'll get that same 3 slides of the pathology consultants.
And my name's Sarah, and so I'm in that marketing context spot in the bottom, and that's my cell phone, and then that's my email as well. You guys can text me, you can email me, you can call me, whatever works best for you, and we can get something scheduled and hopefully help you guys out.
Good, thank you so much for being on. Dion, did you see any other questions that need to be asked and answered?
Not that I am seeing right now. I did have a request to unmute if somebody had a question. I think Paul wanted to speak up with his question as well.
Yeah, hi, can you hear me?
Yes. We can hear you.
Great, thank you. James, I appreciate all the information. I have a quick question, and maybe I'm just not comprehending this, or it's not clear to me. You've mentioned a couple of times that 25% of your rapid response actions have been related to restaurant service industry. I'm just trying to figure out how you got those numbers, or where you're getting that information from for an industry that has been shut down for the vast majority of this. I mean, we were limited to goes, and numerous restaurants shut down completely. How are we such a high percentage when you had retail stores like Home Depot or grocery stores at Walmart? I would assume those industries would be the high, volume of these rapid response actions. Am I just missing something? It's hard to comprehend for something that is, I mean, on our restaurant, we might have, for example, a small restaurant, we might have 10 employees on hand. Home Depot might have 50 or 60. How is restaurants being that high? What do you think is leading to that?
Yeah, Paul, thank you for that question. And the interesting thing about science is that it's very counterintuitive sometimes, right? We don't always necessarily have our intuition may not always pan out, and it's unfortunate that it's a pandemic that it's something that affects people's lives so significantly that we're talking about with data. So since the pandemic began, the Department of Health and NMED have participated in these rapid responses. What that means is, when we get a positive employee or a positive person, we look to see where they're employed, and we go out and we start working on that. There's been a number of fast food restaurants that have been part of this. There's been a number of, in terms of the rapid response, there's been a number of other restaurants that, and I'm not here to name names, by the way, but there's been a number of restaurants that have shown up positive. I'll turn to my team to see if they have inferences that they want to suggest. What I suspect is, and no offense to anyone on the call of any age group, but I think there's been an attitude around COVID that it's not going to affect me if I'm in my 20s. It's not going to affect me if I may not know I'm infected, and I may just go to work, because as studies have shown, folks in various service sector positions don't typically have the means by which they can effectively call out that they may be living more paycheck to paycheck. I think we're seeing that in COVID. I think that's been nationally studied, that this is a disease that spreads among people in jobs like restaurant work. So I think those are some of the reasons we're seeing it. It's hard to put an exact finger on it, but I will ask my folks, Sandra Ely, who's our division director, and Bob Genoway, who's our OSHA program manager. They may have some more inferences that they can share with you that would help explain that. But the numbers are the numbers. So what we're doing is we're tracking NAICS code. So we're tracking the Department of Commerce. We kind of, every time we have a rapid response, we throw everybody into how does the federal government classify you? And we're going through that and grouping people based on those federal government classifications. So that does not include, like, we distinguish grocery stores from restaurants, and restaurants from food manufacturing, and convenience stores are not in that at all. So Paul, I'm sorry if I'm not answering your question. It's just the data is telling us that, and I don't know if Sandra or Bob can speak. Carol, I'm not sure how this all works.
Yeah, they're welcome to unmute themselves.
Okay, so Sandra, Bob, do you want to say anything on that?
Yeah, this is Bob. I'll just say, keep in mind that, most of those cases, they're single individual positive cases of employees that worked at a restaurant where they contracted the virus is not it's not factored into that. So keep that in mind. The data that we're collecting, we started collecting on May 1st. I don't know if for the restaurants that are doing takeout and delivery, whether their workforce, how much their workforce changed from the time that they were doing those operations to the time that you started resuming, much more recently, dine-in operations. But Secretary Kenney's, one of his points is very well taken here, is that a lot of those restaurants are fast food restaurants, and that might account for a lot of it.
Yeah, and I keep seeing the question pop up in the chat, or at least maybe multiple people are asking, or maybe it's just refreshing or something. But where do those numbers come from? Those numbers come from the Department of Health and the New Mexico Environment Department compiling our day-to-day activities in terms of rapid response, and we're tracking that so we can get better equipped, that if we see a trend, we go out and we try to break that trend, because breaking the trend is stopping the spread. Someone else asked, Carol, can we repeat what happens if we have a employee who tests positive? And absolutely, we can repeat that. And let me just say, and I don't say this lightly, and I don't say this in a way that is intended to be clinical, if you will. Our department has gotten very good at, once an employee tests positive, we know what we're doing now. I can't say we did from the very beginning, but we know what we're doing. So within about one business day of that employee getting notified, from the lab, they'll go on to an online system and pretty much check if they were positive or negative. But as soon as we have the data, we will contact the employer. We will tell you, here's what happened. You have an employee who has tested positive. We will then talk to you about, when were they last at work? What is their job? Have you been following COVID safe practices? What have who would they interact with? So we'll do a little bit of analysis, but we will ask that those employees get tested who have maybe it's all your employees, maybe it's some of your employees. And I want, so if this person was in the office, a week ago, or in your establishment a week ago, and they only worked at night, and you rotate shifts, I mean, it may not be that everybody likely contacted that person. So that's why I'm saying we have to kind of work with you on this. It could be that they are the opening manager and the shift supervisor, and they're there pretty much 24/7, and therefore they're going to be impactful with everybody who works in your establishment. That means we're going to probably have everybody tested. We will ask you to shut down while you disinfect. So I know that's not something that people are thrilled to hear about, but that's likely what's going to happen. And we work with people that they can do the disinfection over a night, and be open as soon as possible. So again, we're flexible in how we do that. We ask that you put a plan together. And if you don't have one, and that plan is to protect your employees going forward, to make sure that the spread is not happening, or that a positive employee would not be spreading among your workforce, we ask that the employees get retested within, I believe it's 7 to 10 days after the first person was tested positive. And then that's pretty much it. Unless I'm missing something, Bob or Sandra, that's effectively the process. Test, clean, get a plan together, retest employees, and let's be done with it.
So Director Kenney, we did miss a question earlier about the DOH sending a letter to one of our respondents. She received a letter that was confirmed by DOH that will be sent to any business that has a positive employee, that you will have to cease operations immediately. So does that go in with your previous comments here?
Yeah,
Just
so
to clarify.
yeah, thank you. Our letter, so I'm going to say our letter because the secretary for the Department of Health and I have signed a letter that goes to every employer that outlines what I just said: test, shut down, disinfect, retest, and then effectively you can reopen at that point. You can reopen before you retest, but yeah, that letter, it's scary. It's not intended to be scary. It's intended to be factual, so that you know what's coming. And like I said, we work really hard to sort of give you some certainty about what's coming once you have a positive employee. And that's what the letter is intended to do. You really won't get the letter until you hear from us. You'll know exactly who you're talking to from our department at that point, because we'll contact you to get your email to send you that letter effectively. But we put that letter out there so you know what's going on, you know what's going to come. It's not intended to say that you're going to shut down indefinitely until we figure this all out. That's why I'm saying I think we're probably within a 3-day window on the high end in order to get all this done, but for the follow-up testing. I mean, we've become very clinical about how we do this.
So I have a question on that. You know, I mean, a lot of people tattling on each other right now, and kind of the worst thing that can happen to a restaurant is they have to shut down in order to do this cleanup. Is the state giving this information to anybody? Are we keeping it private? You know, because the fear is if I go get tested and I get my people tested, you know, that means I shut down for 3 days, and who finds out?
Yeah, I suspect, as you may all know, that anything that comes, there's certain information that's hard to protect in when it comes to a state agency. Medical records obviously are protected, but the data you're suggesting, Carol, is public data. People are IPRA-ing it, you know, under the sunshine regulations all the time from us and the Department of Health. They're going through it, they're looking at it. I think one of the reasons I reached out to you, and one of the reasons I'm again really happy that we have a open line of communication, is this is, I think, our opportunity to continue to socialize New Mexicans on, yeah, here's what the science is telling us, and here's what the restaurant industry is doing. And when we say welcome back, we're not saying welcome back and we're unsure if our employees are safe or we're saying welcome back because we have science on our side that's saying we're moving in the right direction here in New Mexico with respect to our restaurants. That's I think us getting ahead of this, us diffusing any allegations or concerns. I know this is scary for a lot of people, and it's scary for us at the Environment Department as well. But I think as we move through 180 some rapid responses, we're getting much more familiar with it, and it's becoming less of a big deal for us. That doesn't mean we treat you like it's not a big deal for your business, not at all. I'm just saying that I think over time, this is going to shift a little bit in that it's not so newsworthy for a Burger King, no offense if anyone's listening to Burger King, to have a positive employee. We came, we saw, we moved through it, we're on the other side of it. That's a lot different when you're a small little independent. I get it, in a small town that you don't have the franchise power behind you. But I do want to say, I mean, I just keep coming back to the point that being proactive about this is I think the best approach to diffuse those reactive moments when people want to make a story about something.
So we have about 5 minutes left, and I will open the phones, but one thing I want to kind of wrap up and tie up loose ends here. So folks can go to the Department of Health, and I know we have that on here, what you sent us. And you know what we'll do is what I will do is have Lawrence put that in this same COVID testing. So it's a letter from you that has all of it's a press release actually, that has all of the names of the departments of health and where they are and what their phone numbers are. So we will be sure and get that in that COVID employee testing as well, so that they have access to that, because not everybody's going to have access to the PCNM. So I want people to know that they do have access and they can get their folks tested. And what else do we need to wrap up here?
Carol, let me just circle back on the face shields versus face masks issue. As of right now, our position is that face masks are required and face shields are options when there's a medical reason why they're necessary. So as you know, and I think you and Allison know, I'm always receptive to evaluating, you know, like, is there a study? Is there a science? Is there a reason? Can we think about this differently? So let me go back and work with our folks and see if there's a reason, just to confirm that we're still in that camp, that face masks as opposed to face shields are the norm.
The other question I would ask this team, Secretary Kenney, because we've had a lot of folks fainting from the heat. So would that be considered the medical necessity? Or does it have to be a pre-existing condition to COVID? Because that will be a prominent question that we've been getting.
Yeah, Bob, I having been in a kitchen, yeah, I get it. Like a commercial kitchen, not just my own kitchen. But I get what you're saying. And Bob, do you want to take a moment and do you want to respond to that now from like or do you want to get back to the association do you want to talk internally and then get back to folks on it?
Yeah, I think we maybe need to check with Department of Health again, just to make sure where they're at for any updates as to, you know, that it's part of the CSP that allows the medical exception, but it doesn't go into the CSP doesn't go into the detail to tell you whether you need a doctor's note or not. But I think DOH maybe be able to provide us some additional guidance as to what documentation you would need to establish that exception. So we can do that.
So I honestly, I don't think we need to establish an exception, because it says ensure all employees have face coverings or masks. This is the CSP from the New Mexico Department of Health. And so I took that and I've been telling people they can have face coverings, the shields, or a mask, because that was coming directly from your directives. And I'd rather not get a different directive, because I mean, my job is to protect restaurant employees as well as restaurateurs. And if the masks are difficult for them, you know, whether they have a pre-existing condition or anything else, if you're wearing a mask in a very hot place and you can't get air. So anyway, that's what I've been telling them, that the face coverings are okay, because it says right here, face coverings are okay.
Noted, and we will, I think you know me well enough at this point, but let me confirm. Sometimes it's better to ask. Sometimes let let me think this through, and I will work with you on this, Carol.
Okay, decide whether you want to confirm that or not. I'm happy with you not confirming that.
I know.
I've got my.
I don't view my job any differently than you view yours. My job is to protect restaurant employees as well, and I think, you know, that is, I want to make sure that we are giving you good guidance on how to interpret things, and I understand your position, and
I appreciate
I'll get
it.
back
Thank
to you.
you.
And this is Bob. Just to add
Yeah,
in,
go ahead.
I can certainly appreciate, we don't want to create other hazards to employees. Now there's, COVID's a fairly substantial hazard. So, when it comes to heat, potential for heat illness, we certainly don't want people suffering from heat illness. So, if and I think you're in restaurants, so I'm sure that employees have all the access they need to drinking water and other methods to make sure that they're not going to suffer from heat illnesses. But if you have questions or need any additional guidance on heat illness prevention, then we could certainly work with you there too.
We have a quick question, and it has to do with the rapid testing or the testing at the Department of Health being only available on Mondays. That's restaurant hours are 8 to 1 o'clock on Mondays. Is that correct?
They're 8 to 11.
Yeah.
And so we did that because there's a number of essential workers vying for limited test kits throughout the state. So I worked with our Department of Health to say, I forget the number, but I think it's like 2,800 test kits for the populations, meaning the food industry that I'm working with, and I need those available weekly. I think 1,025. I said, I think I need 1,025 available weekly, and I will work to get our restaurants, our food industry, thinking about going Monday mornings, because that's when the Department of Health sort of indicated that they had the availability to service a lot of restaurant workers. By no means do you have to go that time. If you say, my best time is to send people on Wednesday at 2, call them up and say, hey, I'm part of the essential group. I can't come Monday. I'd like to come Wednesday at 2 or Thursday at 4, whatever it is. They'll take you. They'll take you. I just wanted to reserve a spot that you all know you could use, and I needed to get those test kits available for you specifically. So that's what I've been working towards.
Fabulous. Thank you so much. I really appreciate you being on with us. And of course, I'll probably have a lot more questions after this is over. And I appreciate you always answering those and keeping us up to date on what's going on. So thank you, Secretary Kenney, for being on.
Yeah, thank you. Thank you to your membership. And again, we take this very seriously. We will work with you. Our job is to support you, not to, and to keep you safe, just like you're doing for your community. So thank you for giving us the opportunity.
Everybody, have a great day. Bye-bye.
Bye-bye. Thank you.